Good afternoon, everyone. Thank you for taking the time to be here today to learn more about the health insurance marketplace in the region. We encourage all of you to engage with us through the workshop. Feel free to type in your questions or comments in the chat or in the Q&A, as I will be moderating it and reading it to our workshop leaders. This workshop is being recorded and will be available in our YouTube channel. Without further ado, I would like to introduce to our President and CEO, Nicole Quiroga.
Hi, good afternoon, everyone. Thank you for joining us. It's always such a pleasure to have our friends and our partners from DC Health Link and other health-related organizations to share with our members during this call, and also when we post this on our social media channels, how to access health insurance. I know that right now we are all suffering a bit through these difficult times, but I cannot underline enough how important this topic is. So I find it to be a real victory, even when we have a small group of participants, that we are able to help and educate in a close, more intimate environment. I appreciate your time and attention. The Chamber, the Greater Washington Hispanic Chamber, is here to help you through these times. So please, should you need anything from us, do not hesitate to call us, to write us an email, to check out our website, gwhcc.org. And let us know how we can be of service to you, because that's exactly what we're here for. Veronica, I'll turn it back to you, but I did want to say thank you again to our partners and to our panel of experts that are here giving their time and attention for the health and wellness of us and our small business community. So thank you for joining us, everyone.
Thank you, Nicole. Now I would like to introduce to our panelists of today. We have Brian Schwartz, Business Development Specialist from the District of Columbia Health Benefit Exchange Authority, Christopher Mata, Healthcare Navigator from the Montgomery County Health Connection, and Margarita Dilone, President and CEO for Crucial Insurance Group, Inc. Before we start with our presentations, I would like everyone to answer to this poll. This poll will help our leaders to know where is your business registered and what kind of health insurance you need. I will give you a minute to answer this poll. All right, thank you everyone for answering this poll. I will share the results with our leaders and with you. The majority of the people are in the District of Columbia. I have one person from Virginia and two from Maryland. Where is the business register? We also have from the District of Columbia and one person from Maryland. And the majority are small businesses, are looking for health insurance for small businesses. Thank you so much. Now I would like to start our presentation with our first speaker, Brian, from the District of Columbia Health Benefit Exchange Authority. Brian.
Thank you so much, Veronica, and thanks everyone for being here today. Thank you to the Chamber for having us. Such an important topic, health insurance, and we'll make sure that, seeing the results of the poll, that we get you the answers on both signing up for small business coverage and individual coverage today. But really glad to be here with Margarita and Christopher as well. We can jump right into the next slide. So as Veronica mentioned, my name is Brian Schwartz. I'm with the DC Health Benefit Exchange Authority, which is a independent agency of the DC government that works to run DC HealthLink, which is the online marketplace for both individual and small business coverage in the District of Columbia. Just a little background on our organization. We were actually the last state to kind of kick it off to start an IT build back in 2013, but we were one of 4 state marketplaces that actually opened on time. If you remember, that was sort of a bumpy start nationally, but we have been, online and rolling since the start in 2013. And we've been able to cut the uninsured rate in half since DC HealthLink opened in the fall of 2013. Nearly 97% of district residents are insured. So we're always trying to get that last 3%, and encourage you, if you know anyone who's uninsured, who's not on the video conference today, to reach out to us at dchealthlink.com. But we are proud to have done that. We have the second lowest uninsured rate in the nation. And we've also been ranked #1 for consumer decision support tools. There's lots of tools where you can do plan matching on our website and find the plan that you need, whether in the small business or individual market. DC HealthLink has also won 3 Amazon Web Services Awards for our IT program. We have a setup that's open source that's been replicated in other states. And we also were asked by Massachusetts to run the small business marketplace for them. And they reached out to us for that. So we've been honored by that, and have also received a bunch of PR news recognitions and recognition for our communications director, Dr. Linda Worden-Boyd. So we're very proud of that, and we keep striving to kind of be the best in those arenas. In terms of who's enrolled in our marketplace, we actually have over 100,000 district residents and employees of district businesses enrolled. So 80,000 employees and dependents are covered through our small business marketplace. And that's anyone who works for a DC business. So you don't have to live in the district. Small businesses just have to have an office in the district, and then they can cover any of their employees. And we have both networks that are DC metro specific and nationwide. So if you're looking for coverage and you have employees who work out of state, you're more than able to do that on our market. We also have, as you may know, all members of Congress who are official employees and registered to be enrolled here in the district. 11,000 plus members of Congress and their staff that are in district offices and work here. And then our individual market, which has been sort of the flagship from the start, has over 17,000 residents enrolled in qualified health plans, or QHPs. If you hear that term, QHP, that means qualified health plans. In terms of the health plans that we do have, we have options that fit all different budgets, and I'll get into that some more. On the small business side, we actually have 4 carriers. And one of the really nice things about DC HealthLink is we operate with a lot of the benefits that large group plans have, or large businesses. Unlike in other places, our small business market is closed, which means we can have competition between our 4 carriers, and they have subsidiaries as well. So you'll see we have United Healthcare, Aetna, Kaiser Permanente, and CareFirst, Blue Cross Blue Shield, and some of their subsidiaries on the small group side. And then on the individual side, we have both Kaiser and CareFirst and 25 health plans between them. That's for 2020. Our 2021 numbers will be pretty similar, I think. So lots and lots of options for your employees to choose from. If we go to the next slide, what I'll be talking about today is what we've done for residents to get insured during the pandemic, during COVID-19. We've taken a lot of extra efforts. What we've done to help small businesses and nonprofits both get insured and stay insured, especially if they're having financial difficulty or furloughs or layoffs. And then what we've done to remove barriers to care for both residents and businesses. So on the next slide, you'll see what we've done to help residents get insured. So I know there's a lot of text here, but we've done a lot. So let me just walk you through it slowly. Usually, if you need to sign up outside of the individual market open enrollment period, if you're signing up as an individual or a family, like so for instance, a sole proprietor who doesn't have any employees, an entrepreneur, someone who's self-employed, you usually need a life event like a birth or marriage or to have moved or something like that. What we've done during COVID-19 in coordination with our board of directors is we've set up a special enrollment period, and we've done that since March. So we've had something that went through September 15th, where if you needed to enroll, you could, even though it wasn't open enrollment, and we essentially opened up our market, working with our insurance carriers to make that possible. And then recently our board approved an extension of that. So I have a detailed press release that you can reach out to Veronica about after this call if you'd like, but it gets into details about not only did we extend our special enrollment period, but also people are able to enroll right away. So typically a special enrollment, you would start on the first of the following month. With our new special enrollment period, you can actually sign up today and you can choose. So if you want to have retroactive coverage that started September 1st, you're able to do that. Or if you don't want to pay for coverage till October and get coverage then, you can do that as well. So we have that through the end of the public health emergency or the end of the traditional open enrollment period, which in DC goes from November 1st to January 31st, whichever is later. Right now, the public health emergency in the district goes through October 9th, but we got word yesterday that the DC Council approved for Mayor Bowser to be able to extend it to the end of the calendar year if she so chooses, and perhaps there would be extensions beyond that. So whichever is later, the public health emergency when that ends, or the end of open enrollment, which is January 31st, 2021 in the district, our special enrollment period, where again, people can sign up today, will go to the later of those two dates. So if you know anyone who's uninsured, or if you yourself are, you should go to dchealthlink.com right after this panel and sign up. In addition to that special enrollment period for individuals and their families, we have a special enrollment period for employees. So for instance, if you have a small business and you're already on DC HealthLink, but your employees missed your open enrollment period. So for small businesses, rather than the calendar year, you can start your coverage anytime. So you could start in July or January, and it goes for 12 months. If some of your employees miss that time for whatever reason, they can come on now and sign up for a special enrollment opportunity and start getting coverage the first of the next month. So we've also had that on the small business side, or the shop side. That's one of our pieces of lingo, is Small Business Health Options Program, or SHOP for short, is our small business coverage. So either way, the takeaway is if you need to sign up for coverage, you can do that now. And just in fact, for some stats, already this year in the last 6 months, nearly 5,000 residents have signed up for our individual health coverage, and 800 people who missed their small business open enrollment period have signed up. And that's just for district residents. So as I mentioned before, you know, a bunch of employees who work for our DC small businesses live elsewhere, like for instance in Virginia, where they don't have a state-based exchange. In Virginia, they use healthcare.gov to sign up as individuals. In that instances, those folks can't take advantage of our SHOP SEP to get coverage because they're not district residents, but all district residents can take advantage of that. So I'm happy to clarify that later. And just the last data point here, we've actually seen a huge jump this year despite the pandemic in enrollment. And I think it's because we do have these opportunities to enroll, which usually are not available. And so we've had, you know, 70% higher signups than last year in April, specifically in early April. And then overall, we've had a 20% jump. So on the next slide, you'll see what we're doing to have small businesses and nonprofits get insured and stay insured. So we've taken a bunch of actions in coordination with our board to make sure that happens. Typically, the rule is for small businesses, if they come into our market, unless they start January 1st, they need to contribute 50% to employee premiums. For this year, even before COVID-19, our board decided to waive that requirement and make it so that small businesses could come on to coverage here at any point during the year without having to contribute to employees' premiums. So that's a huge change and super helpful, especially to micro businesses who might not have the capital to have folks sign up, but do have employees that they want to be able to offer coverage to. They can come on at any time and offer nothing in terms of coverage for their employees at the start, but the employees can get coverage through the small business market, which typically tends to be a little bit more affordable than buying on their own in terms of rates. So that's a really huge benefit. So if you run a small business, please don't let cost be something that prevents you from offering coverage, because it doesn't need to be right now in DC HealthLink. There's also a premium deferment period. So due to COVID-19, we set up something that payments for DC HealthLink don't need to be paid for 60 days after the end of the public health emergency. And again, that's October 9th now, but it might extend and it might extend again. That's automatically applied. So small businesses don't even need to ask for that. So all premiums for small businesses right now aren't even begun to be due until December 9th. That said, Commissioner Karima Woods from DSB, the Department of Insurance, Securities, and Banking, actually issued an emergency order for COVID that said that employers have 1 year to pay back any owed premiums without late fees or interest. So, I don't necessarily recommend waiting that entire year to pay any of your premiums if you can pay some of them, but there is that protection. And if you need to go into arrears or late payments, you have up to a year after, the public health emergency. So there's a lot of time to pay back coverage if you need it. And again, we're not terminating coverage for non-payment. So that's part of that emergency order. If you aren't able to pay your bills, you still get coverage through DC HealthLink. So we're going to great lengths to make sure that works for folks. You can see some of the evidence of that. Typically, in a month, out of our, 5,000 groups and 10,000 workers and dependents, we might have 75 groups that are late on payments. Over the last few months, 800 employers who are on late in payments because maybe their businesses have closed down temporarily or they've had to furlough employees, but they still are able to maintain coverage even though they can't make those payments. So that's a big effort that we've made. And then one more thing, I just want to give a shout out to Care First and United on our small business side. They both offered up to a 10% kind of rebate or discount in coverage for costs for small business employees. So they basically offered premium relief of up to, or actually more than $4 million in May and June for those two carriers that they just provided to make it easier for our small businesses to be able to pay. So that was really great. On to the next slide. We'll talk about the barriers that we've removed for residents and businesses during this time. So our health plans also have offered no-cost telemedicine. So if anybody here hasn't used telemedicine before, I highly recommend it. I know that's been growing in popularity during the outbreak, that you can have a lot of telephone and video visits. Typically, there is some sort of cost for those, just like an in-person session. But one thing that our health plans have agreed to is that all care during this time via telemedicine would have no cost. So that's an incredible benefit. And you can read more about these benefits at dchealthlink.com/coronavirus. All of our initiatives are on there. So dchealthlink.com/coronavirus. And then health plans also agreed we worked with them to make sure that there was no cost for diagnosis and testing for COVID-19 early in the pandemic. And then soon after that, Commissioner Woods also made it so that for treatment for COVID-19, there would be no cost sharing. So that means no copays, no deductibles, no coinsurance for COVID-19 related treatment. So both of those things have really helped anyone who's kind of facing COVID-19 in the district or for district employers. And then the last slide, I think, we'll speak to work that we've done specifically with DOES. So DOES has obviously had a large increase in volume for folks filing uninsured benefits and finding unemployment insurance, and all of the initiatives from the federal government as well. We've made sure that information about DC Health Link is front and center on that page, so that if people are filing for uninsured benefits or unemployment, they see our website right there and can sign up for coverage. And we've also worked with the team of contract tracers through the mayor's office to make sure that anyone that they're talking to who may have come in contact with someone who has COVID-19 or themselves had it know to get DC Health Link. So definitely reach out with any questions that you have. I know that was a lot of information, but again, check out our website, dchealthlink.com. You can enroll today. Your friends and family can enroll today if they're uninsured, if they're district residents, or they work for a district business. If you need to sign up your district business, definitely reach out to me. I'm brian.schwartz at dc.gov. And again, you'll see here our Each One Link One is actually like a volunteer program we have too, in case you know anyone who'd like to volunteer with us. But that's the message. We really, we have advertisements and we have our amazing business partners like GWHCC, but word of mouth really gets the word out about DC Health Link. So thanks so much. I'm happy to take questions later.
All right. Hello, everyone. Good afternoon. I also do want to thank the Chamber for the opportunity to talk a little bit about Maryland Health Connection. Again, my name is Christopher Mata. I am a certified navigator with the Montgomery County Health Connection. And today, what I really wanted to share with everyone watching is kind of information about our coronavirus special enrollment period and other resources that we offer as well. So we can go ahead and go to the next slide. All right, so what we have over here to start the presentation is just two quotes here. I'll go ahead and I'll just read one of them. This quote was from our governor, Governor of Maryland, Larry Hogan, on August 7th. Over here, he stated, "Reopening the special enrollment period is another way we're helping Marylanders weather the storm, get back on their feet, and recover." We also have another quote here from Vincent DeMarco, who is the president of the Maryland Citizens Health Initiative. Really, I wanted to start off with these two quotes because it kind of just emphasizes how important it is to take advantage of this special enrollment period that we are offering due to the coronavirus, especially during these difficult times. We can go ahead and we can move on to the next slide, please. All right, so some updates about our Maryland marketplace. Nearly 58,000 Marylanders have gained coverage during 2 special enrollment periods. We also began offering the special enrollment period for coronavirus back in late March. It originally was set to end twice in the past. However, due to the ongoing pandemic, it has been extended at this point in time until December 15th. So as of right now, we did receive news very recently that existing insurers, which include Care First and Kaiser Permanente, they have proposed rate decreases for the following year for 2021. So overall, rates will be decreasing by 11.9%. And we are glad to say that this is the third year in a row with decreasing premiums for those who are eligible for qualified health plans or private insurance through the marketplace. One other good piece of information to share is that for this year and for the past few years, the health insurance carriers that we have been partnering with have been Kaiser Permanente and Care First. But beginning this open enrollment for plans beginning in 2021, United Healthcare will be do plan to rejoin our state's exchange and offer plans through the marketplace. Okay, next slide, please. All right, so like I said before, our coronavirus special enrollment period is until December 15th. What we have over here is just bullet points describing the dates when somebody applies, when their coverage can become effective. We'll go ahead and we'll skip that first bullet point because those dates have passed, but for the next 3 bullet points, this is going to be the current period that we are in right now. If anyone is to enroll between September 16th and October 15th, their coverage will be effective October 1st. So if someone is to apply through our exchange after October 1st, that coverage will backdate to the 1st of that month. Similarly, anyone applying for coverage between October 16th and November 15th, that coverage will be effective November 1st. And if someone applies between November 16th and December 15th, their coverage will backdate to December 1st. So as you can see here, the earlier that you apply for coverage through Maryland Health Connection, the sooner you can be covered by a insurance plan through the Maryland Health Exchange. Okay, we can go ahead and move on to the next slide, please. All right, so over here on the slide, we're just going to see some basic information about how you can enroll through Maryland Health Connection. So there's many ways to apply with our exchange. First thing is you can go on our website, marylandhealthconnection.gov, in order to apply. You can also download our free mobile application. Our application is called Enroll MHC. So if you are someone who doesn't have access to a computer or you feel more comfortable with applying through your mobile device, you're more than welcome to use our application for that. And you can also give us a call if you prefer to speak to somebody directly. You can give us a call at our state's call center anytime between 8 a.m. to 6 p.m., Monday through Friday. And we do have help available in more than 200 languages. One other number that we don't have listed on the slide, but I definitely do want to bring up is for any residents living in Montgomery County, you are more than welcome to also give us a call at our local call center. And that phone number is 240-777-1815. We can go ahead and move to the next slide, please. Okay, so this list over here is just going to have basic information about what are some things you may need before applying for coverage through Maryland Health Connection. For example, definitely have on hand any birth dates for any household members or those who are interested in applying, any social security numbers or document numbers for legal immigrants, proof of citizenship or immigration status, tax returns for previous years, employer and income info such as pay stubs, W-2 forms, 1099 forms, policy numbers for any current health insurance, and also information about any job-related coverage you or someone in your household may be eligible for. All right, we can go ahead and move to the next slide. Okay, so this is one thing that we definitely do want to emphasize is if an individual is to apply through the exchange, all of the plans that we are currently offering does cover coronavirus. So for example, as it was said previously, health insurance companies, they are required to waive any cost-sharing fees such as lab fees, co-payments, co-insurance, and deductibles for any coronavirus testing at a doctor's office, urgent care center, or emergency room. And one other thing to definitely clarify, because this is a common misconception that we have, is you do not have to be sick. You do not have to be diagnosed with coronavirus in order to take advantage of our special enrollment period. If you are not sick, as long as you are a eligible and uninsured Marylander, you can qualify for the special enrollment period through the 15th of December. Okay, go to the next slide, please. All right, so this over here is just going to kind of summarize what we said previously in the slide before. Like I said before, they are obligated to cover or to waive cost sharing fees such as deductibles. One other thing to bring up is that any deductibles for vaccinations for coronavirus, when a vaccine does become available, will be waived. And also, of course, like I said previously, any co-payments and co-insurance. One other thing to take into consideration is that many health insurance companies are being asked to consider telehealth options. So this will also play a role in helping to reduce the likelihood of exposure and transmission of coronavirus within our community. Okay, and move on to the next slide, please. Okay, so aside from the coronavirus special enrollment period, one other special enrollment period that we are seeing more people qualify for than usual due to the current situation in the pandemic is job loss. So job loss is considered as a qualifying life event for Maryland Health Connection. So due to the pandemic, it unfortunately has forced businesses to close or lay off employees. And due to that, any changes in income or loss of health coverage through an employer, it can qualify you as a life event. And what we also like to place a lot of emphasis on is to please check out Maryland Health Connection before deciding to enroll in COBRA. Of course, COBRA allows employees to continue their health benefits through employer-sponsored coverage for a limited time after they lose their employment. But many plans offered through the exchange, through Maryland Health Connection, can be less expensive and offer comprehensive coverage. So once your employees enroll in COBRA, they do have to wait 18 months before they can enroll in a Maryland Health Connection plan. So definitely we'd like to say, take a look at your options, take a look at Maryland Health Connection, maybe get an estimate on our website before making a decision. And Maryland Health Connection and the Maryland Department of Labor, we also can conduct presentations to support organizations expecting layoffs to discuss their employees' insurance needs. Okay, next slide, please. Okay, so the next section that I would like to talk about is going to be small businesses. Now, as I said before, I am a certified navigator with Montgomery County. So as a navigator, we don't deal directly with enrolling small businesses in coverage. However, I did want to provide just some basic information for those listening who own small businesses and may be interested in offering coverage for their employers. So first question that we have over here for small businesses is your business eligible for coverage? So to be eligible to participate, you have to have a principal business address within Maryland, or you can also offer coverage to each eligible employee through the marketplace, serving that employee's primary workplace. Another eligibility requirement is that you have to have at least one common law employee on payroll, not including the business owner, the sole proprietor, or their spouse. Also, you do have to have at least 50 or fewer full-time equivalent employees employed, including part-time employees, and offer coverage to all full-time employees. So you do have to meet those requirements in order to have your business be eligible for coverage through the exchange. Next slide, please. All right, so if you could go back just one slide, I believe we skipped one. There we go, thank you. Okay, so next question is, does your business qualify for a tax credit to lower the cost of coverage? So the small business healthcare tax credit is available for plans that were purchased through the Maryland Health Connection, and they can be claimed for 2 consecutive years. So up to 50% of your contribution to employee premiums, or 35% if you are a tax-exempt small employer, may be covered by the tax credit. And tax credit eligibility is determined by the IRS. Okay, we can go to the next slide, please. All right, so what are the enrollment options for your employees? So there are two different options. First being the employer choice. So with the employer choice, you can select one insurance company that offers coverage, and your employees may choose any plan from any metal level that the insurance company offers. As you can see on this graphic that we have on the screen, we have 4 different levels with Maryland Health Connection. We have bronze level, we have silver, gold, and platinum. And of course, the higher that you get with each metal level, the more coverage and more benefits offered by that plan. And then we also have employee choice. So if you decide to go with employee choice, you as the employer can select 2 consecutive metal levels of coverage, and the employees can choose any plan across all of the insurance companies offered through the exchange that offer plans at those metal levels that you as the employer have chosen. All right, next slide, please. Okay, and then the last slide, definitely if there's any questions, I'll be more than glad to answer them at the end of the presentation. What we have listed here is just our number to our call center, our 855 number, and also our website. So please take advantage of that contact information. Any questions that you may have, you should be able to find that information online or via the call center. And then you also do have my email address listed if you would like to send me any if you have any questions that you would like to ask me directly, I can definitely reach out to you via email. Thank you again.
This is Margarita, and I'm going to give you some information on individual and small group health insurance from a broker perspective. So hopefully we can have the slides put back up. There we go. All right. So just to let you know, we are licensed insurance agents and brokers in DC, Maryland, Virginia. We do work with Maryland Health Connection, as well as also with DC Health Link, and as well with Virginia, with the healthcare.gov. So we were, that's some basic information on our agency. We can help you with all the insurance policies if you can go to the next slide. Hopefully. Okay. So with health insurance, from a group health perspective, everybody wins with health insurance. And I don't think the slides are, everybody can see them the right way. But okay. All right. We're having some technical issues. Anyway, again, Crystal Insurance and myself individually, if we can help you with both the individual side of the marketplace and the group side. On the group side, one thing that and actually for Virginia, for example, which no one did cover here, if you can switch that slide. Virginia, it does, unfortunately, since it's under the federal system, did not go with opening up the marketplace for a special enrollment. However, small businesses can enroll year-round in Virginia, and we can help them with that. In Virginia, also, one good thing to note is that Cigna is entering the marketplace in Virginia, which will help alleviate some of the rates. Virginia, for those of you that are, I think one person was on the call or on this workshop was from the state of Virginia. Virginia, one advantage that it does have is that if you are self-employed in the state of Virginia, for example, a realtor, and you have a license and you file a Schedule C or a K1, we can do insurance for you in the group. As a group in Virginia, you do not have to have a separate employee. So we can put you with any of the carriers that write group insurance, which is United Healthcare, Care First, and Kaiser. And again, also on the individual side of the marketplace, Cigna's entering. So that's just to give you some information on Virginia. But again, the group side, you can enroll year round. The individual marketplace is not open, and it will not be open unless you have a special enrollment, qualify for a special enrollment event. One of those special enrollment events is unfortunately loss of a job or a significant decrease in your income. So if your hours have been cut or if you've lost your employment, we can get you enrolled on healthcare.gov. I can help you with that. But other than that, Virginia is closed until November 1, and it'll be for, and they only do 6 weeks, unless they change this year. It'll be for January 1. So now for DC and Maryland, though, we can do small group, we can do individual market. And just to recap what Brian said, DC in the group side has 156 different plans available. And recapping and repeating kind of what Christopher said, in DC, you can choose to do a metal level, or you can choose to do a company. So for example, if you decide that you want to offer United Healthcare, you choose one reference plan and your employees can choose that reference plan or choose any United Healthcare plan. If it costs more than the reference plan, they pay the difference. If it costs less, then you basically, they end up maybe getting a cheaper rate for their family members if they enroll them. And you can also choose to offer your employees coverage only or offer them coverage also for their dependents, including for children up to age 26. So there are many options. DC has wonderful rates and wonderful opportunities at 156 different plans. On the individual side of the marketplace, we have Care First and Kaiser, and there's, 25 plans available in DC, and we can help you qualify for all the rates there. You can go ahead and move that. Basically, we can offer you the assistance with quoting for DC, Maryland, and Virginia as a business, or even in the individual side of the marketplace as well in all 3 jurisdictions. In Maryland, for example, a small business, we can still write you both on and off the exchange, and we can see which ways it will be less expensive for you. For example, if you're a very small business and only have 2 or 3 employees, it still might be better going on the individual side of the marketplace, depending. So we look at all the options for you and we'll help you do a plan and do a proposal that'll show you the pros and cons of each way. We will provide you with a summary of benefits. We will provide you with all the necessary information that you need to make a decision, including, for example, health savings accounts. There are several plans that have this option, which give you enormous tax benefits. So if you want to look at those, we can help you with that as well. And if you have any questions, feel free to get in touch with me. I can put in my contact information in the chat for any questions, and there's no obligations. And by the way, neither DC Health Link nor Maryland Health Connection nor any of the nor healthcare.gov, you can work with brokers, any of the licensed and registered brokers at no cost to you. There is no cost to use a broker to help you with any enrollment events. They can't charge you under any conditions for any assistance. So feel free. And hopefully, does anyone have any questions?
Hey, this is Israt. I work in DC but live in Virginia. Can I get DC Link insurance?
You have a business, is that correct?
Yes, I work in DC.
Okay, is the business registered in the district? Do you have a DC location?
We have we are registered in Virginia, but our main corporate office is in DC.
If the corporate office is in DC, I believe we can write you, as long as you have your corporate office here in the district, we can write your insurance for yourself and all your employees, regardless of where they live.
Okay, the employees, we, in terms of like size of employees, we are more than 50. So
Yeah.
we will not be considered, we still be considered as, it's more than 50, it's about 115 or 130 around that. In that case, shall we be considered as small business?
No, you have to have 50 or less full-time equivalent to get into DC HealthLink. So if you have more than that, we have to go off of the exchange, but we would still do it in DC, and we can still get you rates with all the carriers. And we can
Okay.
still write coverage for all the employees even outside of the district.
Okay, and I have another question. If my company does not qualify for DC Link, in that case, being an employee of DC, can I enroll myself and my family?
No, we would have to do, if you can enroll in Virginia when there is open enrollment available, because Virginia unfortunately is federal and it's not open right now. But the company can get insurance as a company because they're not eligible for DC HealthLink. We could still do group insurance, and you could still enroll with them under that condition if they did a plan.
All right, I understand. I was asking about if my company does not qualify for small business in DC, in that case, being an employee of my company and I live in Virginia, can I enroll myself and my family for DC Link? That's what was my question.
Yeah, you can't because you don't live in the district, even if you are employed here. So at that point, and then since Virginia's closed, it would be difficult, but you can contact me. I put in my email and I can see what we can do and to try to help you out if you have no coverage at the current time.
No, I have coverage through my employer.
Okay.
We have, like, we are using other, not through Marketplace. We are using Kaiser Permanente and United Healthcare, but I was looking for better insurances for our employees, as we are a DC company and we have a corporate office in DC. If we can get better insurance for our employees, because the insurance that we are using currently through Kaiser Permanente and United Healthcare, many of our employees feel that is too expensive.
Okay. Well, again, we can try to help you when you're open, maybe 90 days before your renewal. We can try to look at what other plans we can help you with.
Yeah, we are about to expire next month.
Okay, then it's time to get on it if you need some help with that.
That's
More than happy to help you.
That is why I was interested to get into this call today.
Yes, I understand. Yeah, the rates in DC HealthLink are actually quite good.
Yes, that's what I heard.
Anyone else have any other questions? From my part, I want to say thank you to everyone, especially to Christopher and to Brian, because this is really important. As a member of the board with the chamber, we want to make sure that people are informed of not only what is available out here, but the different rates, what they need to do, etc. Because we want every single person, whether they're an employer, employee, or family or individual, that they know what is available and how to get coverage for themselves, because the most important thing that is available for all of us is our health. Nothing else really. You can't, without your health, you can't do anything. We can't work, we can't provide for our families. So let's put our health first. And one thing I'm going to say is a lot of people right now, and myself included, are really challenged because of mental health right now. Because of the pandemic, the isolation, the not being able to go out, see your friends, see your family, and many times even get a hug. So, health insurance provides access to mental health services. That's one of the 10 criteria that's covered under the ACA. So please make sure that all of you are taking care of that. I know I'm going to be jumping on and signing up for some, counseling, because I need it right now. And hopefully other people know about that as well. So thank you very much. And thank you, Nicole, and just the Chamber for doing everything possible to inform the public about our benefits and what's available.
I want to thank the Chamber a lot too. And Christopher, it's great to meet you. Thank you for all your work as a navigator. And Margarita is a true champion of getting coverage for everyone, affordable coverage. So I'm so grateful and encourage people to reach out to her. Even if you're not sure if you're switching coverage, she'll be able to answer all your questions. And again, the Greater Washington Hispanic Chamber is an amazing partner for us. And we do a lot throughout open enrollment, signing people up. And, I see some friendly faces, or not faces, but names on the call anyway, who are attendees, who are also partners. So thanks for all that everyone's doing, and let's get everyone signed up as soon as possible for coverage.